Well, after a lengthy investigation, Stepping Hill Hospital says it has spent the past 4 years tightening security at a cost of more than £3 million.
BBC North West Tonight has learnt that that includes security guards and new safety measures, meaning that every ampule of insulin is accounted for and staff are closely monitored. The hospital has now been rated as one of the safest in the country, as our health correspondent Elaine Dunkley reports.
Victorino Chua, with access to drugs that he would eventually use to murder patients at Stepping Hill Hospital. For months he went undetected. With fear and panic spreading, this was a hospital with its reputation on the line. With over 500,000 patients a year, new measures needed to be put in place to ensure this wouldn't happen again.
We have ensured that every insulin administration is double-checked and we can audit trail that. We've also prescribing insulin on a labelled, individualised basis so as to make sure that there is no surplus of insulin on any ward.
Now, drugs are routinely administered by nurses working in pairs. Passwords and codes are needed to access drugs. Everything is accounted for in exact quantities.
The IT system has provided us with an opportunity where we can drill down to the name of every prescriber, administrator and pharmacist.
Stepping Hill is now the leading hospital in the country for safe drug management and has been awarded a gold standard. This is a hospital that can't let its guard down.
I don't think they're working under the best atmosphere, are they, with all what's going on outside the hospital, but you don't feel it when you come in. It's really, really good.
Well, I should think I've been coming for the last 15 years or even more, and I would never be afraid. I would always be 100% confident to have anything done here.
Staff and patients are monitored now like never before. There are over 130 CCTV cameras in every treatment room and on every ward.
We've learnt lessons and we've actually tried to share some of that learning with other hospitals, but essentially all of our treatment rooms where drugs are dispensed now has CCTV. That was something our staff actually encouraged us to do because they want to provide the care and make sure that everybody can see them providing the right care.
Stepping Hill Hospital has been left scarred by the events of 2011, but it's also a hospital that has made progress in reassuring staff and patients.
Our health correspondent Elaine Dunkley is here now. As you were just outlining in your report, Elaine, stringent procedures now in place at Stepping Hill. What about other hospitals in the region?
Well, we've spoken to every hospital trust across the North West to find out about their procedures when it comes to handling intravenous drugs and insulin. And in the majority of cases, 2 nurses are present when insulin and intravenous drugs are being prepared. There are locks on treatment room doors and on fridges, but we also found that it's not common practice to have CCTV in treatment rooms.
And Victorino Chua, as Claire Fallon was reporting earlier, sentenced today to a minimum of 35 years in jail. Has there been any other reaction to events at Stepping Hill?
Well, the Patient Association said this type of tragedy must never happen again. They also went on to say that the Nursing and Midwifery Council must ensure the rigorous checking of anyone who wishes to gain access to the register and that hospitals must be provided with well-trained and well-supported ward managers. They also went on to say there needs to be a change in culture so that staff can come forward if they do have concerns.
Elaine, thank you very much indeed. Elaine Dunkley.
One of the teenagers convicted of killing Gary Newlove outside his Warrington home has lost his appeal to